In this video, we'll be assessing the head, neck, and lymph nodes. So first, I'm going to start by palpating my patient's head and feeling for any masses, making sure it's symmetrical and making sure there's no pain or tenderness. Any pain or tenderness there?
No.
Okay. Then we're going to move on to assessing the sinuses. I'm going to press here on the eyebrows and we're going to assess the frontal sinuses. Any pain or tenderness?
No.
Okay. Then we're going to press here on the maxillary sinuses. Any pain or tenderness?
No.
Okay. Good. Next, we're going to be moving towards assessing the cervical lymph nodes. I'm going to be using the pads of my fingers, and we're going to be rubbing in circular motions, feeling for abnormalities in size. We want them to be about the size of a pea, making sure they're movable, and making sure there's no pain or tenderness whenever I'm rubbing them. So we're going to start with the occipital lymph nodes. If you'll bend your head forward towards me. Okay, any pain or tenderness?
No.
Okay. Then we're going to go to the post-auricular, which are behind the ear. Any pain or tenderness?
No.
Okay. And the pre-auricular, any pain or tenderness?
No.
Okay, you can tilt your head back up towards me. Next, we're going to go to the jugular. Any pain or tenderness?
No.
Okay. And then next, I'm going to have you do the superficial. Okay. Turn your head to one side for me. And we're going to feel for the deep cervical and posterior cervical. Okay. Same thing on the other side. Okay. Next, we're going to go, face me again, to the submandibular and the submental. Okay, and then the supraclavicular above the collarbones, so poke your chest out a little for me. Okay, that feels good. No pain or tenderness when feeling any of those?
No.
Okay, they were all movable, no abnormalities in size or shape. I'm going to next move to your back and assess your thyroid. So what I want you to do is I want you to turn your head to the right. And I'm going to assess this side of your thyroid. If you'll swallow for me. Okay. All right. And turn your head to the left. And swallow for me. Good. Okay. It was symmetrical on both sides. There were no nodes or any kind of masses, anything like that. Did you have any tenderness upon palpation?
No.
Okay. Next, I'm going to demonstrate how to use an otoscope and an ophthalmoscope. I don't physically have one, but I have a picture and I can explain what's going on. So this is an otoscope. The attachment is separate from the base. You'll want to attach those and then press the button and twist it to turn it on. Whenever you're using an otoscope, you want to be sure to invert it, turn it upside down. And for an adult, you're going to want to pull the pinna of their ear up and out like this, and then use your otoscope. And then for a child, you want to pull down and back on the pinna. Another important thing to remember when using an otoscope is to make sure that you put a protective covering on it. For an ophthalmoscope, same scenario, you're just going to attach the correct head to the base, turn it on, shine it on your hand, make sure the light's working before you shine it on the patient, and then you'll want to come from the outside in to assess the eyes. Okay, and that completes this section.